Thank you so much for the opportunity to provide remarks this morning, and I'm so deeply sorry to not be able to be there in person, marking this incredibly exciting occasion of the inaugural Cure for Cancer conference. As many of you in the audience know, the Cancer Moonshot was reignited by the President and First Lady last year, and it comes with two new and audacious goals. The first is to reduce the cancer death rate in the United States by 50% over the next 25 years. That equates to preventing roughly at least 4 million cancer deaths within that time frame. And although speaking as a scientist, no doubt there are many of you in the audience today who love numbers and stats just as much as I do, it is essential to remember that this quantifiable goal is so much more than the numbers. The numbers represent real people, parents, loved ones, children, all looking for more time together. And that is why there is a second goal of the Cancer Moonshot, to improve the experience of those living with and surviving cancer. Since reigniting the Cancer Moonshot, the President has made it clear that this is a fight he is unwilling to postpone. The same words President Kennedy used when he spoke about choosing to go to the moon. To meet these goals, the President and First Lady have called on federal agencies, researchers, healthcare professionals, leaders, and advocates across the cancer community to share their knowledge and their skills. And this past year, through the Cancer Cabinet bringing together over 20 U.S. agencies and departments, the Cancer Moonshot has already spurred tremendous action, including over 50 new programs, policies, and resources. In addition, more than 100 private companies, nonprofits, academic institutions, and patient groups have really stepped up with new actions and collaborations in alignment with the mission of the Cancer Moonshot. Many of you sitting in the audience today, and we are so grateful for your dedication to this mission. I would like to, however, take a minute to share our vision for the broader global work, because while the immediate goals of are domestic, the ambitions of the Cancer Moonshot extend far beyond the borders of the United States, especially as the burden of cancer falls heavily to lower middle-income populations, where the vast majority of global cancer deaths occur. Because we know that no one country can solve the world's problems, but together we can build a better world. And that is why, as the Cancer Moonshot broadens our scope, our international work focuses on equity and collaboration, words you will hear time and time again today, thereby increasing access to prevention, early detection, screening, treatment, and care for everyone facing a cancer diagnosis and their families around the world. This work was kicked off in last December as part of the U.S. African Leaders Summit, which was hosted by the President, where the First Lady and the Second Gentleman hosted a spousal event and announced commitments from the private and federal government, totaling over $300 million to improve cancer outcomes in Africa. These included efforts to strengthen domestic public health infrastructure and build resilient healthcare systems, as well as funding for robust and impactful initiatives in Africa on cancer prevention, screening, treatment, and research. And it's why this meeting today is so important, so that we can continue to find ways to work together to tackle really hard, complex challenges that, if solved, will really affect millions around the world. And it's why we're so excited to see countries coming together to focus their efforts, identify the gaps, and make deliberate plans to make progress forward. Examples in the past year have included announcements and formations of expert working groups between the EU and the US around lung and pediatric cancers, the announcement from President Biden and Prime Minister Modi of a US-India cancer dialogue, which will bring together experts from both sides to tackle complex challenges. US experts have been deeply engaged with G7 countries, partners in Ireland and Northern Ireland. In addition, the President has had substantial engagement with Japan and the Republic of Korea. And just this past month, a report was released on ideas and opportunities generated by a UK-US Scientific Cancer Summit, which brought together world-leading UK and US researchers, clinicians, patients, advocates, and industry representatives. We've also seen incredible commitments made by the United States to global initiatives to improve cancer care, like the additional investment of $7 million, to IAEA's flagship program, Rays of Hope, bringing our total financial and in-kind contributions to this initiative to more than $47 million. And we are equally excited about the incredible work unfolding between the US and Australia on clinical trials that will be announced later today, and an early congratulations to all of those involved, but especially Dr. Bob Lee. And what I'm most excited about is that we are living in an unprecedented time where the President and First Lady have made the Cancer Moonshot and its mission a presidential priority. The President has included the Cancer Moonshot in his unity agenda to rally the American people behind this mission. But the momentum that the President and First Lady have created is being felt across the globe, and we are so excited to see the progress that will be made in this next year, because we are just getting started. Our ability to strengthen international collaboration around key oncology elements like clinical trials, data sharing, and basic and translational research will accelerate new and innovative treatments for all cancer patients. Working across national boundaries also means sharing best clinical and care practices, new ideas and innovations, and reaching more people with effective ways to prevent, detect, and treat cancer and lessen the toll on human life. Building strong partnerships and cooperations between countries are the key to making progress towards ending cancer as we know it. Thank you for being here today. Thank you for your contributions to this work, and looking forward to hearing what a wonderful day today will bring. Thank you.